An essential component in the course of the government's efforts to contain COVID-19, its commitment to medical confidentiality, is being compromised by the media. This is the view of Deputy Chief Medical Officer Dr. Karen Gordon Boyle, who alluded to the recent COVID-19 related death at the Georgetown Public Hospital, GPHC.
I have no problem with the media updating the nation on numbers. I have no problem with saying what regions have what numbers and so on, age groups that are affected and so on. But when you go to the point of actually naming someone, saying this person, has COVID, tested positive for COVID, that's infringing on people's privacy. That's breach of confidentiality. That breaks so many rules of engagement. And it just should never, reporting would require that you don't share people's personal information. Never.
The family members of the deceased reportedly learned of the woman's death via the media as against health officials delivering the sad news. Shalana Providence, communications manager at the GPHC, in responding to these claims, admitted that there was a glitch in protocol which resulted in the family not being initially notified via the official source. On Friday, in an interview with this newscast, the Deputy Chief Medical Officer acknowledged that while the Ministry of Public Health is not always timely in conveying the death of a patient to the affected families, it still does not give the media the right to relay sensitive and confidential details to the general population.
Imagine I have to hear about my mother's death or my mother's death from COVID-19 from the TV. Who's there to make sure I don't have a heart attack when I hear this news? Who's there to make sure I break the information is given to me gently in an empathetic manner, that I have a chance to offload and talk out my shock or whatever? Who's there to make sure that it's managed in a responsible way? That's not the way we do things.
She maintained that the ministry does not divulge the names of any COVID-19 patient or casualty, but rather provides daily updates on the national case incidence and prevalence. Nonetheless, the media has played an integral role in sensitizing the populace about the dangers of COVID-19 and how they can stay safe, Dr. Boyle acknowledged.
We depend on the media to support us, and I think so far the media's been doing a fantastic job. We couldn't be as far as we have been in terms of raising awareness if the media was not working with us. So don't get me wrong. The media is doing a fantastic job. It's just these little things that speak more to, standards and quality that we got to look at.
Since Guyana's index case in March, the identities of a significant portion of COVID-19 patients and casualties have made it into the public domain. Temika Rodney reporting for the HGP Nightly News.